Welcome to Save a Life in 1 Hour, a first aid course taught by real paramedics. In this module, you'll learn a 7-step action plan that will give you a systematic approach in order to save a life. This action plan is known as DRS ABCD, Doctors ABCD. So let's talk about D. D stands for danger. You're no good to anyone if you're a patient yourself. You need to be worried about danger to yourself, danger to your patient, and also danger to the general public. Say you come across a patient who's been hit by a car and is lying on the road. If you run out onto that road without checking for danger, there is a chance that you'll be hit by a car too. If I was to come across a situation where a male was lying on the ground, unconscious, and there was a knife on his chest, well, this would be quite an obvious danger. So I would remove the knife. Step number 2 in our 7-step action plan is R. R stands for response. Is your patient responsive to you? Are they conscious or are they unconscious? The way that we check for a response is by 2 methods. Firstly, we need to give a little bit of verbal stimuli. We do this by saying their name. If you don't know the patient's name, ask them their name. For example, with my patient lying down here on the ground, I know his name. His name's Ali. I'd walk up to him and I'd say, Ali, Ali, Ali. If he does not wake up to verbal stimuli, the next step to check his response is to inflict a little bit of pain. The way that we do this is by pinching the patient on the shoulder. Ali, Ali, Ali. If your patient does not respond to verbal stimuli and painful stimuli, then he's unconscious. The next step in our action plan is to send for help. S stands for send for help. If you're in an area where you have a reliable ambulance service, you need to call them. Use your phone. Make sure that you know their number off by heart. If you don't know their number, go and memorise it now. If you don't have a reliable ambulance service in your area, you're going to need some more help. Send a bystander to go and get some more help, and also a transport vehicle. So, can you go get some more help and get a car? We need to transport this patient. Okay, thank you. The next part of our action plan is A, B and C. Airway, breathing and compressions. Let's have a look at A. A stands for airway. Your airway is the passage that air takes to get into your lungs. In the first aid setting, to check an airway, we need to open the patient's mouth. If you see something in his mouth that's not meant to be there, like broken teeth or food, get it out. You can use one finger to scoop it out, or if you can grab it with 2 fingers, that's fine too. Sometimes there may be blood or vomit in the patient's mouth. So what we need to do is drain. Roll the patient onto their side, gently. Pull the patient's head back and open their mouth and let the blood or vomit drain. Once you're happy that there's no more blood or vomit coming out, roll them onto their back. Make sure you do this gently. Next, we're going to talk about B, which stands for breathing. We need to know if our patient is breathing. The way that we check for breathing is look, listen and feel. Watch whilst I demonstrate. I'm looking, I'm listening, and I can feel that there's air. So this patient is breathing. If the patient is breathing, then we need to roll them onto their side. Just like before, gently roll them onto their side. If the patient is not breathing, then it's a medical emergency. We need to move on to C, which stands for chest compressions. We need to push on their chest hard and fast. Where we aim is the centre of their chest bone. What I'd like you to do at home is find your own chest bone, right in the middle. When you complete chest compressions, use the palm of your hand on the patient's chest bone. Straight arms and get nice and close and push down hard and fast at a rate of about 100 a minute. If you're not too sure, you're better to go a little bit too fast than a little bit too slow. Keep going, do not stop until an ambulance arrives or the patient starts to breathe. If you're in an area where there is no ambulance, then keep going for about 30 minutes. If the patient has not started breathing after 30 minutes, then it's unlikely that they'll survive. 30 minutes is a long time to be doing chest compressions. So if there are bystanders that can help you, ask them to. Try to swap every 2 minutes. You can take over from there. The last step in our action plan is D. D stands for defibrillation. If you're in an area where there's an ambulance service, it's likely that they will have a defibrillator. Defibrillators can save patients' lives. Sometimes, in certain areas, there are little defibrillators called AEDs. That stands for Automated External Defibrillator. Anybody can use these. They're very simple. AEDs come in many different shapes and sizes. They tend to look something like this. There are two main components to an AED. Firstly, the unit, and secondly, the pads, which are connected to the unit. The pads have pictures on them to show you where to place the pads on the patient. For example, in this one, this pad goes on the top right part of the chest. This one goes on the bottom left side part of the chest. Remember to always remove the clothing before popping the pads on. Follow the instructions that the AED tells you and make sure that nobody's touching the patient. If you're using the AED, you're in charge. What an AED will do is pass electricity through the patient. So if somebody's touching the patient, there's a chance that they can get shocked too. So now let's demonstrate how to apply an AED.
I've got the AED.
Perfect, thank you. Thanks, Eric. Can you take over that? Fantastic. Can you undo his shirt for me?
Analyzing rhythm. Everyone stand clear. Shock advised. Charging. Everyone stand clear. Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
Continue CPR and follow the AED instructions until an ambulance arrives or the patient starts breathing. If you're in an area that doesn't have a local ambulance service, continue for 30 minutes. If after 30 minutes the patient hasn't started breathing, it's unlikely that they're going to survive. So now we've gone through our DRS ABCD action plan. Danger, response, send for help, airway, breathing, compressions and defibrillation. If you're in an area with a local ambulance service, they will take the patient to hospital. If you're in an area where you don't have an ambulance service, then it's up to you to take the patient to hospital. So to move a patient, you're going to need to improvise. If you don't have equipment, you need to make do with what you've got. A great way to move a patient who's unconscious is by using a sheet, a blanket or a shawl. Doug, can I borrow your shawl?
Yes.
And Mohammed, can you help us carry this patient? Sure. Guys, I'll get you to kneel down. Mohammed, I'll get you to put one hand here and one hand on his hip, and one hand on his hip and one hand on his leg. What we're going to do is roll him towards you. I'm going to slide this sheet underneath him, and then we'll roll him back. You're in charge of the rolling. On your call of 3 is when we roll. Everyone understand?
Yes.
Okay, your call.
1, 2, 3, roll.
Okay, your call.
1, 2, 3, back down.
And I'll get both of you to squat next to the patient. Roll the shawl to make sure you've got a good grip. Is everybody ready?
Yes.
Straight
Yes.
backs on 3. 1, 2, 3. Let's walk in. If the patient is conscious and can't walk, you can do a chair lift. You only need 2 people.
Three.
Now you've learnt your 7-step action plan. DRS, ABCD, doctors ABCD. I'm going to show you a scenario where we incorporate the entire action plan. Ali! He's unconscious. Can you go get some help? Okay. Oh, he's not breathing. Oh, thank you. Can you take over this CPR? Can you take off his shirt? It's not breathing. It's not breathing.
Shock advised. Charging. Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
Just stop for a second. Is he breathing? Oh yeah, he's breathing. Let's roll him over to you. Gently. Can you help roll him? That's okay. Once we're ready. 1, 2, 3. Breathing out. Dolly, can I use your shawl? Okay, I'm gonna roll them towards me. 1, 3, 1, 2, 3. Now we'll get you come around here. So everyone ready? 1, 3, 1, 2, 3. And out.